push away from the pain. Yeah, so it increases, it gives a kind of stretch over here. So because during pain what happens, it pulls the spinous process towards this side, so we are just putting the pressure and moving it the other side, so it relaxes. Okay, so this is the position. So just make sure that one thumb is enforcing the other one. Just place it near the spinous process. Okay, and press this. Okay, can you able to feel the movement?
Yes.
Yes. Okay. So another position what you can do is with your you know thumb enforced with the palm, because sometimes people may not be comfortable in doing this, so they prefer doing the enforcement with the finger and the base of the palm. So you place it, palpate the spine, relax, palpate the spinous process, place your finger and place your base of the palm and give the pressure. So move the spinous process away from the pain. That's it. Okay. So postero-anterior unilateral vertebral pressure. Posterior, anterior, so which approach shows that posterior to anterior and unilateral vertebral pressure. So mainly if the patient is having any unilateral pain arising from the thoracic spine, so done on the painful side. So starting position is prone lying, so stand on the side to be mobilized. Okay, so placing thumbs pointing towards each other, lie over the transverse process. Okay, so what you have to do is just assume that the left side is painful, so you have to keep the hand on the transverse process. Okay, so on the transverse process, okay, so what you have to do is like this. You have to place the pressure like this. Okay, so place the pressure like this and push. Alright, so this is the one. So this should be on the table. Stand on the side of the side to be mobilized. So place the thumb pointing towards each other, lie over the transverse process. Okay, spinous process. Okay, transverse process, place it like this. Okay, so just apply little pressure over there. That's it. Okay. So to achieve bone to bone contact, apply steady pressure to move muscle belly out. Okay, so perform oscillatory movement by increasing then decreasing the trunk movement. So here what you can do, you can make the trunk to be moved. Okay, so we can perform the oscillatory movement by increasing and decreasing the trunk movement. Okay, so what you can do is, okay, so slowly spinous process. Okay, try to slowly move your trunk up and down, no, one side only, slowly. Okay, yeah, slowly move up. Okay, relax. Okay, move, relax, move. Can you feel the movement?
Yes.
Yeah, move, relax, move, relax, move, relax. Okay, then go to the next one. Perfect. Okay, move, relax, move, relax, move, relax. Okay, so thereby you can just go one by one. Move, So while you are moving, asking the patient to move, give a pressure downward. Okay. Can you feel the pressure? And are you feeling the vertebral movement? Down, relax. Okay. Down, down. Are you feeling the movement? Move. Okay. So this one you can easily make out by just palpating this side and that side. So while starting both sides it was spasmed, but now I could feel the muscle is relaxed over here compared to the other side. Can you just touch and feel? Are you finding any difference? So while you're doing, just use the pad of the fingers, okay, and just put the pressure in this way. This and this. If you press too much also, it is going to be very difficult for you to differentiate. And with less pressure also, it's difficulty in differentiating. Just you could find. You could find, right? Yes. Okay. So, postero-anterior unilateral costovertebral pressure. Postero-anterior unilateral costovertebral pressure. So mainly when thoracic intervertebral mobilization does not produce improvement. Okay. So if the rib is moved as treatment, it will also create movement for those thoracic spine. Okay. So when the thoracic intervertebral mobilization doesn't work at all, then we can select this technique, which is postero-anterior unilateral costovertebral pressure. So the terminology itself showing you very clearly, right? So the approach is from posterior to anterior, and here we are doing unilateral costo. Costo is
the
rib cage, right? The costal bone, the rib bone, right? So costovertebral pressure. So where the union between the costal bone and the vertebral bone happening. Okay. So if the rib is moved as a treatment, it will also create movement for thoracic spine. So patient position should be in prone lying, prone comfortable position, and therapist position place thumbs along the line of the rib. So the maximal contact is achieved between the thumbs and the rib. Okay, so something like this. Okay, so we have to so where we have to stand, so place thumbs along the side of the rib, so the maximal contact is achieved between the thumbs and the rib. So an oscillatory movement is transmitted to the ribs by thumbs or hand. So compare the pain produced with the rib above and rib below. So compare rib on the opposite side. Okay, so pressure applied posteriorly through trapezius muscle with pressure inclined towards the feet. So which means that we have to be standing over there, right? So we will be standing over there. Okay. So the same position, the hand will be placed side to side. Okay, and placed over here. Can you feel the movement?
Yeah.
If you look at the leg, yes.
That's been on the first rib.
Yes. If you look at the leg, you can see the movement is transmitted over there downwards. Can you see? The foot is going down. Okay. So just place the hand side to side and give a pressure downward. Okay. So this. Okay. This one, if thoracic mobilization is failed. Okay, so this is the another option to mobilize. Okay, fine. So it should be done on the first rib under the trapezius. Okay, so you have to move and move the trapezius. Okay, fine. So you guys please practice this. So and after that the massage remaining technique will be taken care. Okay, so you just scroll it down